It is the 15th of September, the middle of the month already. Can you believe that?
Wow.
Wow. This is Wayne Goldsboro Television. Hello, I'm Wayne Alley.
And I'm Kate Daniels.
Yes, you are. How are you?
I'm good.
Wow,
I'm good.
here we are. You know, spring, or fall. Fall is right around the corner here. Yeah,
yes.
It comes in on the 23rd this year, I think.
Know.
And the first thing you know, it's going to be the fall kind of year, time of year. Lots of festivals, lots of things to do.
Talking about the holidays,
love
rolling
it.
right in.
Yeah, that's exactly right. Speaking of which, today being the 15th, today, in case you're interested, is Make a Hat Day.
Oh, like a paper hat?
Anything.
Or like a straw hat?
It's also Felt Hat Day. This is a day that traditionally, when men wore felt hats, this is the day they'd put their felt hat away.
Oh.
And then they'd get a toboggan or something. I don't
Yeah,
know. Yeah, I don't know. But anyway, it's Felt Hat Day, but it's Make a Hat Day. And yesterday, I failed to mention that yesterday, and this is important, was National Cream-Filled Donut Day. National Cream-Filled Donut Day, and I don't know how I missed that.
I bet it's not too late for us to go to Krispy Kreme today, though. It's never too late.
I bet you're right. Okay. All right. What's going on?
A lot of stuff going on. You know, this week is marking the end of a deadline for the Duke Energy Citizenship Award.
Mm-hmm.
The Wayne County Chamber of Commerce was contacted last year by Duke Energy. They give a small handful of these awards out across the state, and they were just really impressed with what was going on in Wayne County, and they brought the opportunity to us. And so last year at our Leading Wayne Leadership Conference, Selena Bennett, who is the Executive Director of Communities and Schools, was awarded the first annual Duke Citizenship and Community Service Award.
Wow.
So we have got just a few more days. The deadline is on Thursday. The information is on the Chamber's website, or you can give us a call and we can email it or fax it to you. Nominations are for an individual person or a group.
Oh, really?
So say there's a group or an organization or an individual that has just truly exemplified what community service is all about, is leading the way and inspiring other people. It's a big honor, and we want to hear from our community. We want to hear from you, and the deadline is Thursday.
Thursday of this week. That's day after tomorrow. So
get on it.
We're talking about volunteer groups. We're talking about families. We're talking about neighborhoods, businesses, church groups, anybody or a single person
who's leading the way.
Who's leading the way.
Who can we honor? And we will honor this person or this group on October 22nd. At the annual Leading Wayne Leadership Luncheon. That is a mouthful.
That is Leading Wayne Leadership Luncheon.
Which is fantastic. This is like the 5th or 6th year I think that we've done it. It is awesome. You leave this luncheon and you're like, I can do anything I want to do.
You're pumped.
You're pumped. I mean, you're just pumped.
Woo!
Yes.
Okay.
I'll leave the wooing to you.
Woo! Woo! Okay. Woo! Okay. So that's day after tomorrow, and again, they submit applications or nominations where?
Well, you can go online to the Chamber's website. It's waynecountychamber.com, or you can contact us.
Okay.
But do it today.
So that's 734-2241.
Very nice.
Well, I just made it up.
That was good.
919-734-2241, waynecountychamber.org. Also, coming up soon, and I have to read this off of this thing here, University of Mount Olive holding a concert featuring the U.S. Army Field Band and Soldiers Chorus. These guys are fantastic. The event will be Thursday, October 15th, so you have exactly 1 month to prepare and get ready for this. It'll be at 7:30 at the George and Annie Dale Carnegie Arena. The 65-member concert band and the 29-member Soldiers Chorus is the oldest and largest of the U.S. Army Field Bands. The joining of these two ensembles allows them to offer unparalleled versatility of programming. Now, the chorus is performed in all 50 states, Canada, Mexico, India, the Far East, and throughout Europe, in fact, entertaining audiences of all ages. The musical backgrounds of Soldiers Chorus personnel ranges from opera and musical theater to music education and vocal coaching. This diversity provides unique programming flexibility. In addition to presenting selections from the vast choral repertoire.
Oh, good job.
Soldiers Chorus performances often include the music of Broadway, opera, barbershop quartet, and Americana. Again, this is October 15th at 7:30 in the George and Annie Dale Carnegie Arena. at the University of Mount Olive, and that's going to be a great program. Looking forward to that. I
Absolutely.
don't have ticket information. Even if I don't have any ticket information. Okay, but anyway.
Well, we can get that. I'm
We'll get
certain
that.
it's at the University of Mount Olive's website.
Mhm.
And when all else fails, contact the chamber,
There,
and
there
we'll
you
get
go.
it for you.
There you go. UMO.edu.
Good job.
Hey, I can throw out letters
You
of the
can.
alphabet
Look at you,
anytime.
and
know?
phone numbers.
Hey, EIEIO. How about that, partner? Okay, we're going to take a break with our interview, and we'll be right back. Thanks for watching. This is Wayne Goldsboro Television, in the heart of Goldsboro, in the heart of Wayne County. Our guest in the studio today, Dr. Stephen Peters at Cherry Hospital, is back with us. How
Well,
are
thank
you doing?
Always good to be here. You bet.
Always great to
Doing
have you
well.
in the studio with us, Stephen. Steve, here of late, there have, for the last year or so, or in fact 2 or 3 years, you hear or see an increase in coverage on mainstream media of what appears to be an increase. It appears to be an increase in mental health issues.
That's right.
You're all the time seeing where a mental health patient or someone suffering a mental health issue has either taken up arms, or they have created a disturbance of some sort. And so, is there actually an increase in mental health problems across the country?
Yeah, it's a common question these days, because we do see a lot of that. And when we see those concerns, they're sometimes catastrophic. So it does make everybody concerned about it, and we start thinking about that. And so we think about, is there an increase in the actual prevalence of these conditions, of these illnesses that people suffer with? And the research bears out that there's not an increase in the actual frequency or how common those conditions are. But and it kind of gets back to a question of how well are we taking care of people, and how well are we taking care of those conditions, such that how well are they being managed, and are they getting the services that they actually need, and that perhaps and it's sort of a national problem. And while in North Carolina we struggle with this issue, it's sort of a national struggle to sort of justify the cost, and to have providers who are out there, the access to people who have this level of specialization and service, so that everybody has good access. And that's actually hard to do.
Now, a few years ago, Steve, there was a reform that was brought before state government and local governments, in fact, national government.
Yeah.
This reform, they felt there was a lot of expense involved with mental health.
Right.
And I suppose the effort was to try and cut costs, cut back, and just see how it would work out. So how did it work out?
Well, in mental health, it's always been a struggle to justify and kind of and show how effective you are. So you can have a program, a mental health center, and while it's costing a lot of money, to say, well, show me how this is helping people. And it's kind of hard to do research or studies to kind of justify how effective that is. One thing you can do, though, is sort of take away the services and see what happens. And one would think, well, what do you think would happen? Let's say they were effective. Those mental health centers really were a good idea. But let's see, if you took them away, what do you think would happen? Well, what has happened is things have not gone so well.
They have not.
And so, in a way, we've sort of done a live research study with the population, right? A study that you would never really want to embrace or carry out. But we've kind of done that. And it sort of does demonstrate in the long way to go that, yes, services are effective. The more mental health care, all those services that, let's say, a mental health center would offer really did help people. And now that we don't have those services so much anymore, and they're hard to come by, you see people struggling more with their impulses, with their struggles, with their diseases, with their problems. So yeah, we're seeing the symptoms of mental illness more frequently now.
Well, now, how does this play out? If you would, give me a scenario, give me an idea of how this would play out. And I know this is a tough question. This is hard to do. But if someone is suffering from a mental issue, they're having a problem of some sort, and they feel they need help.
Right.
They need help. So they go to their physician. They say, and the doctor says, yes.
The
why
number
don't you?
one place to start
Yeah,
is with your primary care physician.
Okay.
Go see your doctor, the person that really knows you best, hopefully, and
And-
it also knows
what do you say?
what services. Say, Doc, listen, I need to talk to you. I'm having some problems. I need to talk to somebody. And he'll say, well, tell me about what kind of problems are you having? And then to be very honest and frank about, well, this is what I'm going through. And to kind of explain to him kind of what your struggles are.
You tell him you have these thoughts that are
These thoughts, these voices, these that you can't sleep, you're pacing.
somebody's out to get you.
Yeah,
or,
yeah. And that
paranoia.
your worries, your fears, all those concerns, and that you need some help to deal with that. And hopefully then that physician can say, well, listen, I know some people, here's where you should go get help. Let me find some place for you, and we'll kind of help you get into the place you need to see.
Okay. So from that point, let's say this patient or this person or this consumer.
That's a consumer.
It's
That's
a
the term
consumer.
we
That's
use
the
now.
term used in the medical health industry.
It is now. Yes,
The
indeed.
consumer goes to Cherry, let's say, and they say, I'm here at Cherry Hospital because I need help. I need to see a doctor. I don't know what's wrong with me.
Yeah, yeah.
So then they go through those steps.
Yeah.
So they admit themselves to the hospital. And depending on their the severity of the issue, depends on how long they're going to be there.
Yeah, yeah.
How long normally does someone stay at Cherry?
Yeah. Well, it's an interesting idea, just the idea of can people come as a voluntary
Exactly.
request help from Cherry, a place like Cherry Hospital.
Can they do that?
You actually can, but it's actually done in a very, it's done very rare. We're kind of for folks when nothing else has helped.
Oh, I see.
We don't. I always say we don't want the simple when you could just have some services in place and still stay at home. You don't really need to be in a hospital. All of those services should be tried first.
Okay, so find a private practice.
Yes.
Psychologist, psychiatrist,
Yes. Social worker.
Social worker.
A lot of good folks out there that can help.
private practice.
yeah.
Do that first.
Yeah.
And then if you still have a problem at that point,
Then maybe
Correct.
say, well, maybe do I need more than
yeah,
this?
the doctor can take care of that.
Sure. And in the 38 counties that Cherry serves, we have a lot of community local hospitals that have services.
Right.
Here in Wayne County, of course, we have Wayne Memorial, who
Right.
has a psychiatric service. There's a way to access those programs. And then if that's not enough, then we eventually say, well, maybe Cherry Hospital, where you can stay longer.
That's almost a last resort.
More of a
sort
last
thing.
resort.
Yeah.
We use the term a safety net.
Okay. right.
So when there's nothing else that has been there,
Last resort sounds so final.
it does sound kind of
Fine.
discouraging.
Yeah, it does.
Yeah,
it
well,
really
the last
does. All right,
resort.
it's a safety net.
It's
Okay.
a safety net is kind of the term we use now. When all else has been tried, and what we also like to think of as least restrictive, that people really should be able to get care in their community. You stay at home, you live at home, wherever you happen to live. You stay with your support system, you stay with your family, people you know, and get care while you're still in that community. Now, if that is all falling apart and is not sufficient, then it's a pretty big step to have to come into a place like Cherry Hospital.
Yeah. Yeah.
Now, a lot of folks come into Cherry Hospital, and they're not all that long. Could be a few weeks even. There are folks then that also stay a little longer. These are a little more complicated situations, maybe so many months. And then we have actually a smaller number of people than what most people think these days that actually have been there for a very long period of time.
That's a small number.
It's a very small number, and that most people do not need to be there for years and years and years and years. I think there was back in the days, so to speak,
Yeah.
if you came into a place like Cherry, you might be there for many, many years.
Yeah.
And that's a pretty small number these days
Yeah.
that really require that level of care for that long a time.
And that's because the care and the medication has improved.
It has a lot.
Considerably,
It's
yeah.
incredibly different now.
Yeah.
It's safer. The taking it can have, these are fairly strong medications, and they need to be. And so they can have side effects that are unpleasant, but the newer medications, and it seems like there's new ones coming out all the time, are a little more gentle to take. There's not as much side effect to deal with.
Okay, so back to the point of why do we have seemingly have more of a problem now with people having major mental issues and
Sure.
with the violence.
Well, I think it
and
comes back
everything.
to we have to ask that question: how well are we taking care of people? And maybe we're not doing a good as job collectively across the country now in getting people into services, into care, keeping them stable, keeping them on their feet, and we're waiting too long before we get somebody into care.
Are we leaving it up to the consumer to take care of himself?
Sometimes, and we
That's
want,
not good, though, is it?
Well, we want informed consumers.
Yeah.
We wanted to know, hey, do you know this is it comes down to things like eating well and all those things we hate hearing about, like getting exercise
Yeah.
and all those kind of things that we know are healthy, but we hate hearing about.
Yeah.
But it's sort of like, yeah, we want to educate people about even good mental health service and how to get along when there's conflicts, and
Yeah.
how you talk things out instead of getting physical with each other. When you have financial stress, how to get a control over that, get some control of your spending, and sort of manage your financial so you don't have so much stress about that factor.
The stress is major.
Yes, it
that's
is.
a major contributor to this.
It is.
Yeah.
And
Because once that starts, it almost can consume people.
It can snowball on you,
Yeah.
and then not only so you have the external stress, and then your reaction to the stress. If it's a negative reaction, now you've just sort of added more trouble to the troubles, and now we've got stress because of the reaction to the stress, and so it can snowball.
Under a doctor's care, physician's care, a doctor's care, people are prescribed medication
Yes,
to
sir.
control this and to handle this.
Yeah.
But we're often hearing about, well, gee, he did this because he was off his medication. So who polices that?
Yeah, nobody's the answer to that.
Nobody.
Nobody can make you take your medicine, but I think it's sort of like.
Well, how's it done before?
Well, we had people often talking to somebody, people like myself or social work, psychiatry, who could talk to you about how helpful it is and why it's a good idea to keep taking it. You know, I use that example about it. Well, if you had your arm hurt and the doctor gave you some medicine, but it made you sick to your stomach,
Yeah.
or gave you big headaches,
Yeah.
And it didn't help your arm that much, you probably wouldn't take it. You might call up and say, I'm not taking this.
Yes, I've
And
heard
it's just
that.
not that effective. So we have to ask, well, how effective are the medications and the services anyways? Well, and the fact is that, well, if you can, so we do have some side effects to deal with. A lot of the medications, though, if you keep taking it, a lot of those side effects, your body sort of adjusts
Yeah.
to these chemicals a little bit. And so you have less side effects. And it does take a while for some medications to be really completely effective. So you have to you need some encouragement, some support to sort of help you understand that. That just because you took it last night and you don't feel any different today, well, that's no time to judge it.
That doesn't mean it's not working.
Doesn't mean it working, it just means it takes a while.
Okay.
And so you need somebody to talk to about that. What are your expectations? What else can you do in the meantime while your medicine is kicking in, while it's getting built up a little bit? What else can we do to manage this stress? So it takes all of that. It takes a team, really, a team effort to sort of help somebody sort of understand that, yes, this medicine is not, it doesn't make everything just go away, but boy, it makes life a lot better. And it's a lot better now than if I wasn't taking it.
Yeah. So, support from family,
Yes.
support from spouses,
Sure.
support
From
that-
professional people.
professionals.
Yeah, to actually talk over some of the specifics of this. But all of that, it takes the village, is the thing we like to say still.
Yeah.
It does kind of take that.
Yeah,
And
it
it
does,
is a
yeah.
team effort, there's no doubt about it.
You got to do it. You've
Yeah.
got to do it. You've got to continue taking that medication.
You do. It's real helpful.
So from this point on, what would help the situation? Well, first of
Yeah.
all, there's a lot of coverage on television. Every time somebody sneezes, well, he forgot to take his medication.
Yeah, and,
You
and
know,
it's
and
not
he-
just medication, because it's having somebody to talk to, and the person has that some control,
Yeah.
and using the controls that they have. It's not just medication, and so, but medication certainly plays a big part in it.
What about somebody who is not willing to admit they have a problem? Now, what do
Yeah.
you do then?
And
isn't that the biggest
There's certainly that, because you
number of people?
Yeah. How do you help? How do you talk to somebody about how, when they don't feel like they need it,
Yeah,
why it's a good idea to take it or get some service,
yeah.
and getting that kind of support. Now, unfortunately, we have people who do not want the service, refuse the service, catastrophic things happen, and then that's when programs like Cherry Hospital come into place,
Yeah.
and people are actually committed there involuntarily. Probably about 95%, 96% of the folks that are at Cherry Hospital are there not because they want to, but because they've been involuntarily committed. A couple different assessments, and then an independent Wayne County judge has says, yes, I reviewed this case and they need to be there. I mean, it's sort of a civil rights issue, really.
But now, they're not being locked away. If the judge says they need to be at the hospital, they're committed involuntarily.
Right.
It's for a reason.
That's right.
It's to get help.
That's right. And their case is constantly reviewed.
Okay.
So it's not like you're just going there and stay and nobody's ever watching over it. So this idea that we have an independent, separate process where those decisions can be discussed, reviewed, and scrutinized. You should have to explain and be able to convince a court that a person does need to be there. Even though they would like to leave, it's important that they stay. And you have to justify
and
that.
get the help.
Yeah, yeah.
So if you have a situation with a family member or a spouse and the spouse doesn't feel they need help, talk to the physician, talk
Yeah.
to the minister, talk to the person, talk to family members.
Right. Seek some professional advice.
Get help. Get professional help.
And a lot of times it may not be the person who's our identified consumer,
Yeah.
but it's a family member, and they're struggling with this as well, so that they can go get some help and get some coaching, some advice on how to better engage, how to help persuade, how to encourage somebody into getting service.
I don't know this for a fact. I haven't heard of it happening, but I would have to guess that some people would call law enforcement.
That does happen. Certainly things escalate.
Yes.
And it gets physical sometimes.
Yeah.
And it can be very disturbing, very upsetting,
Yes.
and frightening. And that is a time when law enforcement, we have a pretty interesting program called CIT, critical incidents, or crisis intervention training.
Crisis intervention.
Yeah. So that law enforcement, more and more are being asked to intervene on these kind of matters.
Oh, boy.
And so it's not writing a citation for a speeding ticket. It's not, the typical law enforcement, historically not a typical law enforcement issue. But now police and sheriffs are being asked to come and intervene on these very distressing, complicated situations.
And that's when it's even that much more difficult to be a cop. I'll tell you,
It
I
is.
would not want to be
Yeah.
in that situation as law enforcement.
Yeah.
They certainly do their job.
That's
I
right.
am
But giving them some help, and these are some techniques, these are some approaches you can take so that they're not just left up to their own device
Yeah.
as to how to intervene there.
Okay, so I go back to what I was asking
Yeah,
before I led us astray. What do we do now?
Yeah. Well, we try to find ways to get more providers. It starts at sort of the grassroots level.
More professional help.
More professional people have got to come to our part of the world, our geography.
Come to Wayne County.
Come to Wayne County. And find this as a community that you can be a part of. Set up a practice, set up whatever services you offer to attract the providers that are very effective into our part of the country. And then find ways to with some overview, find a way to make it cost effective. So it's tax dollars ultimately, and that becomes problematic. If tax dollars are just being not used wisely, so we all get concerned about that.
I'm sure our legislature and all the members are doing the job they think they need to do to keep our expenses down, our taxes down, our costs down as much as they can. But this is an area that we really need to focus on. We
and
need
it's
help in.
that good stewardship of mental health dollars.
Yeah.
That is probably more complicated of a dilemma than how do we provide services in an underserved community.
When you're talking about professional help, or professionals coming into the community, we're talking more than psychologists, psychiatrists, are we not? What are we talking about?
We're talking about, obviously, to me, it's psychiatry, social work, and psychology, all three of us, kind of. But the thing now, what's really kind of catching on, and it's kind of exciting, is what we call peer support. Somebody, a consumer, who's been through their own personal struggles, but now have some success story to share, that they can be available to sort of say, well, listen, I know what you're going through because I went through it, and this is how I managed. And that's pretty effective. Of course, it's what we've known in the substance abuse treatment for a long time. We've had people who were involved in substance abuse and in addictions trying to reach out to people, sponsors in AA, things like that, because maybe you'd hear it from somebody that's been through it. And so now we're kind of borrowing that idea into what we call peer support, and that has kind of caught on. Obviously, clergy, our ministers and pastors do a lot of pastoral care in terms of can talk to people. People go to their pastors and their, the clergy to find some advice and seek some counsel.
Yeah.
Wow. That's a good start.
It's an interesting issue and an interesting topic, and it will be with us for a long time.
There's not an easy answer.
There's not an easy
the
answer.
take-home message.
Yeah, not an easy answer. So talk to someone, talk to your physician, talk to someone in the family, talk to your pastor. And of course, we always welcome Dr. Stephen Peters to come into the studio and talk to us about whatever we want to talk about.
You betcha. It's always good to be here.
It's always good to see you.
Yes,
Thank
indeed.
you, Steve.
Your source for what's happening in your community is Wayne Goldsboro Television.
And we're back on Wayne Goldsboro Television. Thank you for being with us today. It is Tuesday. It's the 15th of the month.
Already.
It is just moving along quickly. And today being Tuesday, that means tomorrow, beginning at 8 and ending at sometime in the late afternoon, you can head out to the farmer's market at Herman Park and enjoy the fresh veggies and the fantastic deals they have out there on veggies. And they have flowers.
They do. They have flowers and
stuff out
honey.
there. Honey.
The honey's been fantastic.
Yeah. I ran into
Sugar.
darling, honey. Ran into Beekeeper Bob the other day. I didn't hurt him. I helped him up, but I ran into Beekeeper Bob, and he is beekeeping right along. Yeah. And we've got what do we have here? If you're a senior citizen and you need a notary, well, the senior citizen has a notary at your service. Did you know that the Senior Center has notary services available to all seniors 60 and above? It's free of charge. That's even gooder. I didn't say that, did I?
Yes, you did.
No, I didn't. It's by appointment only. So make an appointment. You can call Bell Chandler at 919-731-1589 to schedule an appointment. Okay.
Look. I don't know what to do with this guy.
Huh? What? Okay. All right. What's going on? Speaking of which, so I mentioned this before.
Yes.
I forgot to mention it again. September is honey month.
Yes.
Yes. So there you go. Be aware. Okay. Coming up on Thursday of this week, Thursday being Constitution Day, special event going on at Wayne Community College. And by the way, let me mention, we'll have special guests in here Thursday of this week. Thursday, no, I'm sorry, that was last week. I'm all turned around.
What is today? Who are you?
Today is February. Anyway, on the 17th, which is Thursday of this week, at Wayne Community College, and this is open to the public now, everybody can go to this, at the Wayne Learning Center, which is the big building, in the atrium there, you go in where the big flags are and walk through into the atrium. They're going to have a voter registration drive. They will have citizenship posters displayed by the Wayne Community College Criminal Justice Club. They will have refreshments served by Wayne Community College Student Government Association. And that's all beginning at 9 a.m. At 11 in Moffett Auditorium, Judge Erica James.
She's great.
She is great. She's a
great.
district court judge for the 8th Judicial District of North Carolina. And beginning at 11 a.m., she will have a program in the auditorium entitled The Constitution and Basic Civics. How much do you know?
Are you smarter than a 5th grader?
Well, I'll tell you, I guarantee you there are 5th graders who know all about the Constitution.
Yep.
And they would put most adults to shame.
To shame, you're
Yeah,
right.
Really.
So that is Thursday, September 17th. So that is during the day.
That's
and
during
that
the day.
night, guess where everybody needs to be?
The
The
17th?
Wayne County Historical Association. For what?
For what?
For business after hours.
Oh, there you go.
We are so tickled that they are opening the doors and inviting the business community to come out from 5:30 to 7.
At the museum?
And at the museum. Is that not exciting?
That is exciting. I love it.
We're so tickled. And they've partnered with Ed's from downtown, Southern Food and Spirits, and they're going to have great food there. I can assure you it's going to be a wonderful time. And it is Thursday night from 5:30 to 7. It's floating, so come on in when you can and mix and mingle
There you go.
and pass a business card. That's what it's about, and we're just real excited
That's fantastic.
to be with them Thursday night.
If you're new to the Wayne County area, or if you have never been to a business after hours, you need to go to this thing because it is it's great. It's just great. That's all I can say about it because you make contacts, you meet people, and if you're new to the area, this is perfect for you.
So, and it's a lot of fun.
Yeah.
And this, to my understanding, is the first time that we've done a business after hours at the museum.
At the museum, and I love the museum.
It is a mighty special place.
Can you believe I had a guy the other day who said, you know, I don't have anything, you know, we've talked about this. There's nothing to
Yeah.
do around here. And I said, well, what are you looking for? Well, you know, and Raleigh's got museums. And I said,
Yeah.
we've got a museum. He said,
Hello.
where? He said, we have a museum here. I said, yeah, it's on North William Street near the post office. Check it
Yep.
out. All kinds of stuff. You'd
Yep.
be surprised.
Yeah.
All right, so business after hours, the
Yep.
17th, that's Thursday night.
That's right. So Thursday, by Thursday,
Uh-huh.
send in your nominations for the Duke Citizenship Award. Head on over to Wayne Community College that morning, and 5:30, come on out and see us for business after hours.
That's going to be a lot of fun.
That's your day plan.
That's a busy day.
Stick with us. We'll
That's
tell
right.
y'all where to
That's
go.
right. There you go.
That's right.
There you go. And we're going to actually leave right now. We'll be back tomorrow, though. We'll be back on Wednesday, so I hope you're able to join us at that time. Remember now, it's Channel 10 on Time Warner Cable, and on UVerse, AT&T UVerse, it's Channel 99. Hope you're able to join us. The show shows at 7 a.m., it repeats at noon, then it goes again at 5:30 p.m., and I thank you very much. For Wayne Goldsboro Television, I'm Wayne Alley,
And I'm Kate Daniels.
and we'll see you tomorrow.